Welcome to The Wellness Code. Nurse Melinda from Finish First Medical is here to share a variety of medical information and solutions to enhance your health and well-being. And now to guide you through The Wellness Code, Nurse Melinda.
Well, Nurse Melinda, how are you doing today?
I'm doing fantastic, Michael. How are you?
Well, I'm doing excellent. I can tell that you are actually the real Nurse Melinda because it says so right there on your shirt. So.
That's in case I ever forget who I am.
Oh, I see we have the same mom. Just sew their name on there so they won't forget.
That's right.
Oh, Nurse Melinda, I think before we start into this, I want to make sure that everybody knows who exactly you are and where they can find you. And I know that you own Finish First Medical.
Yes.
In St. George. Where is that, by the way?
It is on South Bluff Street.
Right here in lovely St. George?
Yep, right downtown.
So if somebody wants to get a hold of you, what's your phone number?
Oh, my goodness. You have to memorize your own phone number. It's 435-500-6734.
And I bet you have a website.
Yeah, it's easy. It's www.finishfirstmedical.com.
Okay, we got it. So I know today on the Wellness Code, we want to talk a little bit about regenerative therapy. And I know, yes, I can tell by my extra telepathic powers, plus the fact it's written on this piece of paper, I know that you've been reading a book about stem cell therapy. It's called what? Stem cell therapy, raising the tide, a rising tide, or something like that.
Yeah, it's Stem Cell Therapy, A Rising Tide by Neil Rord. How do you say his name? Rordan. He was according to the book, the guy that started the Stem Cell Institute in Panama.
Oh, so he kind of is a big deal with this whole thing.
Yeah, big deal. He has a lot of studies and a lot of different modalities of treatments and stuff that he talks about in the book, which is really, really good because it gives you a bigger perspective of what stem cell therapy or biologics or exosome therapy can really do for us moving forward.
Oh,
yeah.
So tell me a little bit about the book and what have you learned and discovered in his book?
I have learned. Well, it's interesting because I've been doing stem cell therapy for about a year now, and I see major miracles happen. Like if I told you some of the stuff that I've seen, it would be, what snake oil are you giving me, or how is that possible? But when I'm reading his book and he talks about things that they've seen in their clinics and in clinical trials, and it just solidifies the benefits of stem cell therapy.
So is what you've seen in your experience, does it correlate with what's talked about in the book?
Yes, it does to the most extent. And I think the number one question most patients have is, how often will I have to do this? Is this a one-time thing? And in his book, he talks about different disease processes, I guess you could say, because we should know by now that most of our disease processes and our autoimmune stuff is from inflammatory reaction. So if we can decrease the inflammation. But anyway, so he talks about how sometimes after a year or after 6 months or after 8 months, people with certain conditions are having to have more than one treatment. Yeah. Where it's been in my education so far that 85% of people that come in just need one treatment. But it really depends on what you're doing. If it is an acute injury, one treatment and it should be golden. But if it's a long-term, and we've talked about that before, if it's a long-term chronic thing, then it's one of those things of you've got to learn what your body feels like and how to know whether it's working and recognize the benefits of it, and then recognize when it's starting to wear off, because your body clears that within the 8 months, according to the book.
Wow. So give me an example of something that you think sounds like snake oil, but when you read the book, it kind of makes it like, oh, that is a legitimate thing. Can you share a real life experience with us?
Yeah. So we had a patient who came in. It was kind of the last ditch effort. She was wheelchair bound, wasn't able to get up and walk anywhere. And when I'd first heard about her, it was one of those tilt your heads and go, really?
Yeah.
But
Really?
within 2 months of getting a therapy treatment, she was walking through the temple.
Really?
Yep, left her wheelchair in the car.
Wow.
And she told me, this literally has changed my life. And so it's crazy. It's just crazy, but sometimes we do treatments and you don't feel it. You know it's working, but you don't feel it because maybe you came in to do a treatment on your knee, but you might have something internally going on, like something wrong with your lungs or your heart or your blood vessels or whatever. So your body innately will heal its internal organs and its vital organs first. So you don't get much treatment with the knee. And so we have other therapies at the clinic that we do in conjunction if you came in with the knee.
So what you're saying is that the stem cells kind of work on a priority basis. So if I've got a problem with my knee, but the stem cells go, you know what? The heart is actually takes priority over the knee. We're going to fix that first. Is that kind of what they do?
Yeah. Yeah. So that's kind of what they do. They will go to wherever the cell signaling is that needs repair, and they'll go there. And of course, our vital organs are going to be more important than your cartilage in your knee. And so if that takes up all the cells or the majority of the cells, then we're going to have less. But really, we have to wait 6 months to see where that treatment really benefits, because maybe it's working in the heart right now, but 5 months down the road, you're seeing benefits in your knee. It might take that long.
So it's not like they're nanobots where you can program it to perform a specific function. You just turn these little rascals loose and they go, oh, hey guys, let's go over here. We need to fix this heart. But we're supposed to go to the knee. No, we got to do the heart first. That's pretty incredible.
Yeah, and maybe in the future of medicine, we will have those little nanobots that go directly where we want them to go. But right now, not quite so much. We have exosomes, which is the repair agent of a stem cell. We can grab those for the heart or for the pancreas or for the kidney, and those specifically go to repair those areas. But stem cells, no.
Do they work with everything in the body, like with bones as well as organs and things like that?
Yeah. Yeah.
Really? So, I fractured my wrist. Do you have any extra stem cells in your purse? I can slam a few and maybe that'll fix it up for me.
I wish. And that was part of the discussion I wanted to talk today about, because when we get further into this, more and more clinics are going to be doing this. More and more people are going to be announcing they have stem cells. And what exactly is stem cells? Because I can't just pull them out of my purse. Real stem cells have to be frozen and kept frozen at negative 80 degrees.
Oh.
And so they are frozen up until the time we administer them.
Wow.
Yeah. So that's how you know if it's a real deal or not. If they come in and it's powder form, or they call I never can say it, live-sized. Oh my gosh. That's a long word. Anyway, it's powder formed. It means it's been, kind of
like dehydrated.
Yeah. And then we remix it. Those are exosomes. Those are not the same thing. They are a stem cell product. And so we get this big variety of stem cell. And I think that's where the issue is even PRP. If I pulled PRP blood from you and I spun it down and I got the serum out of it, the plasma out of it, it's plasma-rich proteins is what we're trying to do, right? But those are your stem cells.
Okay.
But it's not stem cells. Does that make sense?
Yeah, it does.
So stem cells is a big variety, and it's going to be a word that is just going to be blanketed out there. And so we want to make sure, if you're considering some type of treatment, whether you come to me or there's a few providers in town that I really, really trust, that you get the answers you need, that they know it's coming from a lab. You know it's frozen at 80 degrees. You know the chain of custody. You know that, like this company, for instance, I don't know if I can show the company name per se, but this company, for instance, every time they send out, can you see that? They send out a certificate of, what is this?
Analysis?
Certificate of analysis.
Oh,
so
yeah.
It tells you what is in it, where the batch come from, what the tissue ID is. Like, this is legitimate, right? It's not some magic guy in a hotel room.
Yeah. Oh, and it's actually in English, not in some foreign language.
In English because it's an English lab. It's an American lab.
Yeah.
It's in the United States.
They're not outsourcing from China or someplace.
I don't outsource from China or someplace, right? Or I don't outsource from Mexico. And even though the book is written by the guy that did the Stem Cell Institute, and the institute is in Panama, and they are years and years advanced compared to the United States and what the United States will and will not allow. But with that, it's still, I don't get my stem cells from Panama.
Oh, okay.
You know what does that make sense?
Yeah, that makes sense. I have a question, though.
Yeah.
Based upon something you said earlier, that the real stem cells, the real deal, they're frozen at 80 degrees below zero.
Yes.
All right. So how are you putting those in my body? I'm thinking that if you're going to inject something that's 80 degrees below zero into my vein, the whole thing's going to freeze up. How do I get this stuff?
Well, and that's the key, right? There are different providers that do different things. I have been taught to unthaw them basically in my hand, and once they are unthawed completely, then you infuse them or inject them, whether you inject it into the joint or you inject it in the muscle. There's other practitioners that have little warmers that they warm it up to a specific degree, but we know that once the cells are thawed out, that they start to die off. And so we want to make sure that there's that fine line of having as many cells as we can and still warm enough to put it in your body. But if you do it too early, then the body has a vasorestriction type thing where it goes, holy crap.
Yeah, that's really cool. Woo.
Yeah, and it only lasts about a minute or two, but we want to avoid that.
Okay. So to make sure that I'm getting a good product, number one, I need to ask you, my trusted medical professional, and more than likely you're going to show me the certificate of analysis to alleviate any concerns I may have, to make sure you've got them from a trusted source and you followed all the proper protocols to make sure we're getting healthy, frozen, not previously thawed out stem cells.
Right.
Or powder form, which are, what is it called, exosomes?
Exosomes. Now, if you come in for exosome treatment, for instance, if you come in for erectile dysfunction and we are going to do an injection specifically in that area for erectile dysfunction, those are exosomes, and we can mix those accordingly, right? So there's room for that, absolutely. And we have other modalities of treatment for that. Like we do it on the skin. We get your hair to grow back with exosomes, things like that. But yeah, so there's a difference between stem cells. The stem cells broad is not.
Yeah. So an exosome is a byproduct of a stem cell. What is that exactly?
It's the repair agent. So when the stem cell finds the cell signal, this is going to be like in the most simplest terms I can say.
Yes, please. I need that. I need it that way.
When the stem cell finds the cell signal of repair that needs to repair, it attaches, it designates or differentiates that, and then it releases proteins and exosomes and things like that, mitochondria, to fix the issue. So the exosomes are the repair agent. It's part of that protein matrix.
So can either one of those, the exosome or stem cell, can they be used to regenerate some type of cognitive functions with people who have Alzheimer's or something like that?
So there is a theory that it
Let's talk about the theory.
can help. There are studies out there that say that it can help. Now, how does it help? We don't quite know. I mean, there's plenty of studies, but we're on the brink of making this to where it's publicly knowledge, Thank you for the internet on the one thing that we can have. But make sure, too, if you're doing your research, that you research scholarly articles. You don't just research some random website. But there is great evidence for Alzheimer's as well as autism and how it decreases the symptoms and can increase your memory and cognition.
Wow. What about burn victims? Can it regenerate healthy skin tissue?
Well, that's the crazy thing about it too, is we have some wound care products that we can put on that are stem cells that are grown specifically for wound care, and you put them directly on the wound, and then the wound, kind of like you would do a skin graft.
Yeah.
But instead of grafting the skin, it's sheets of stem cells, and you put them on the wound, and the wound heals amazingly.
Wow.
Yeah. Like it's crazy. This is so cool.
How long would a process like that take?
It depends on how severe the wound is.
I've got a 3rd-degree burn, and you're putting this stuff on the area that has a 3rd-degree burn, like an estimated time frame?
Yeah, a 3rd-degree burn. I mean, you're looking at, blisters and things like that, but I would say it's going to speed up the recovery by days.
Really?
Yeah.
Wow.
Yeah, and decrease the pain, because the stem cells themselves are anti-inflammatories. So it'll decrease the pain, and yeah.
This is powerful stuff.
I know. And it's crazy to me to think that not a lot of people know about all the options. And so when you see like an ad now, because Facebook allows some ads, people will say this is illegal. Well, first off, it's not illegal. Okay. It is just not FDA approved. There's a difference.
What's the difference?
The difference is the FDA does not have significant evidence through studies to say we're going to approve it and allow our insurance companies to pay for it. So most of the therapies are not insured. The insurance doesn't cover it. There are some therapies like for leukemia that it will, but gradually the FDA is handpicking what, based on the evidence. But we still have evidence that it works, but we don't have evidence that it works enough for the FDA to approve it for insurance to pay for it. Does that make sense?
Yeah, it does.
And so when the FDA doesn't approve something like that, we can do it in the state of Utah, especially, but we have to have a disclaimer that the FDA is not approved of this, and that, some therapies, which would be like some of your PRPs and the stem cells themselves, are not FDA approved, and to consult a physician before going under.
So is that part of the advertising and marketing rules that apply nationwide, but especially in Utah?
That is part of the Utah. I don't know about nationwide. There are some states that are not allowing marketing at all, and there are some states that are actually closing clinics if they market.
Really?
Yes.
But Utah, you can do limited marketing?
So far, Utah is allowing limited marketing. So, it's a fine line, because I really want to help as many people as I can now that I can.
Right.
But the best thing is word of mouth. The best thing is coming in and trying it and getting it for your wrist, and then seeing how that works for you. And then, you telling your neighbor that it worked.
Yeah.
Does that make sense? Because everybody's different too. And that's one thing about the way medical is moving as well, is everybody's different. And in the book, they theorize that eventually we'll be able to harvest cells from you when you're a baby, and that we'll have specific medications for you as you get older based on that.
Wow. I think I saw that on the Twilight Zone.
The little scanner that tells you, yep, we got some of that already.
Wow. That's amazing. So before we go, I take it that one of your main goal is just to help as many people as you possibly can with the stem cell therapy, and hopefully at least the state of Utah keeps it going and doesn't do what some of these other states do.
Yeah.
Even though it's not FDA approved, it's not illegal. I want to make sure that's important. People understand that this is not illegal, or I've heard some people say that it's unethical or something like that.
Well, and and the unethical comes from the fact that they used to use embryonic cells, and that was from aborted fetuses or from, babies that didn't make it. And the labs in the United States do not use aborted fetuses.
Oh, good.
They all use umbilical and combined placental.
Okay.
So these are the byproducts of the delivery anyway. But there's no unethical sources. They're donated from the mom. They're tested. that's the nice thing about having these labs in the United States is we know that the labs in the United States have rules and they're going to go through the rules.
Right.
So when we get the product, it should be healthy and work great. And I really just want to make sure that anybody listening to this, if you're seeing advertisement and you're considering stem cell therapy, by all means, it's amazing. It is absolutely amazing. But make sure you ask, where do you get your cells? What kind of cells are these? How do I know they're good cells? Is there a lab? Are they in the United States? Are they being monitored? Are they safe? Because we want to make sure that if you're going to do this and you're going to pay for it, that because insurance doesn't pay for it. And as you can imagine, this process isn't cheap just to even obtain the cells. Yeah. But if you're going to pay for it, then make sure you get the product that you deserve.
Yeah. This is fascinating stuff. So if somebody has questions about more about stem cells and how can they get a hold of you? Can they come into your office for a consultation?
Yeah. All of my initial consultations are free. Okay. And they're mainly for me to get to know the patient and understand where you are in the journey of life and offer services that I can help with and to develop that like, love, and trust. And if that doesn't happen and you have other sources, then, or you want other referrals, there's, like I said, I know a couple of providers in town that are doing really good work. Happy to refer if I'm not your person, because that's really the goal for me, is to make sure that you get the care you need.
Great. So how can we get a hold of you? What's your phone number and website and address?
Oh, yeah. So you can call me at 435-500-6734. That's our medical line. It is secured. So if you call or text that number, it does go in a medical record, just so you're informed. Okay. And or you can go to our website at www.finishfirstmedical.com, or you can stop by. We're in South Bluff Street next to the Maverick, sort of by Beans and Brew.
Great. Well, Nurse Melinda, this has just been a joy and a delight. I've learned more about stem cell therapy today than I have my whole life.
Each day I'm learning.
Wow. Hey, we'll see you guys again next time with another Wellness Code podcast with Nurse Melinda.
Thank you.
You've been listening to The Wellness Code with Nurse Melinda from Finish First Medical in St. George. For more information, finishfirstmedical.com. Please like, subscribe, and share. And we'll see you next time on The Wellness Code with Nurse Melinda.